First of all, I want to welcome you all. For some it will be in the morning, others in the afternoon. And here in Belgium it is, late afternoon or evening. So we're going to start. I will give you a general introduction, what is known and what is still unknown about COVID-19. Because as you all know that the changes of informations every day, there's something else that comes around. Can I have my slides, please? Yes. So my introduction, I'm François Eyskens from the University Hospital of Antwerp, Belgium. I'm a pediatrician and also a metabolic disease physician. And I treat this, most of the time pediatric patients, but also adults with metabolic diseases, including Fabry disease. So what do we know about the virus and the disease COVID-19? What we know is that it started probably in China due to a zoonosis. So it started from transmission from animals towards human beings. And at this moment, this is not the case anymore. So it is a person-to-person transmission by droplets. The virus that causes the disease is called SARS-CoV-2, and it gives rise to a serious infection named by the WHO of COVID-19, and is very virulent. It has a spread factor of 2.5. So every patient can give transmission of the virus to 2 to 2.5 persons. And therefore, there is a rapid increase of infected patients. Most important is, it is a devastating disease. It's not just a flu, as it was called in the past. No, it has a high morbidity and a high mortality, and I will show you with the slides that I'm going to present further. Next slide, please. Most of all, it's a pandemic. So it's a pandemic because now all over the world, the disease has spread. And in this curve, you can see that there is an exponential growth of the numbers of patients that are encountered all over the world. And we call that an exponential curve. As you see, it goes up very rapidly. And that's the same with all the patients that got infected, but also the patients that got very serious disease, devastating disease, and also the mortality that is still rising. As you can see on this slide, well, most of the people are young people that are affected. The young people, as I will say, so between 20 and 40 years of age. Children are in a minority, and that is not very clear. Most of the children, the disease is not that serious, but we still don't know a lot. And there are children already dying from this disease. So we cannot say that it is a milder disease in children, but it's for sure that there is a very small number of children that are very seriously affected, and most of them recover when they are infected. This is a very serious group that has a very, that can be affected very seriously, above 70 years of age, and that's a risk age, and I will come to this later. As you can see, all age groups can be infected, but most of the time there are some risk factors involved. Can I have this next slide? Please, next slide. Well, this is a comparison between the seasonal flu that we encounter every winter and the COVID-19 disease. And as you can see, as I already mentioned, the RO number, so the there are a lot more people that are infected by one person that has the disease, and it is much more than compared to the flu. Incubation time is, well, it varies between a few days until 14 days. And in the flu, it's normally only a few days. So it can last very long before you develop symptoms and signs. And therefore, when someone is coming into contact with a person who has the COVID-19, then you say that, well, they should stay in quarantine for 14 days at least. And most what is now at this moment, dus the disease of the persons that are having the disease are highly contagious 2 days to approximately several hours before symptoms appear. Dus even none of people who have no symptoms at all, no clinical signs, are already infectious. And that explains also the very rapidly this transmission of this disease. The hospitalization rate is very high, 2% in the common flu, 19% to 20% in the COVID-19. And the mortality, this is a devastating disease, the mortality rate is very high. 5 to 10% of all infected patients can die of the disease, and that is still a number that increases still. And we all know about Italy and also Spain, where the mortality rate is very high, but also Belgium, the country where I live in, we have a high mortality rate, and it is comparable to the Netherlands. And so at this moment, we don't know how much people will die from this disease, unfortunately. Next slide, please. The clinical symptoms and signs, well, it is fever and also respiratory symptoms and signs, a dry cough and a shortness of breath. But I come back to this later. Most important is that it can also affect several other organs. So it's not only an airway disease, it is a multi-system disease. So it can cause also problems with the lungs, it can cause problems with the intestines, it can cause problems also with the kidneys. In the blood, we don't find that much abnormalities, only a decreased white blood cells. And most important is when you have a decreased white blood cell count, especially of the lymphocytes, and also in addition, this diffuse coagulation disorder, that will mean that there is a bad this evolution of the disease going on. So decreased white blood cells is also a prognosis factor. Next slide, where I will show you then the most important symptoms and signs. So there is mentioned that there is a loss of smell and taste in the patients who develop the disease. But that's not for sure that every patient will get it, and we don't have a percentage. Fever is there, present, but not in all patients, and can be rather low. So not very high fever is encountered in this disease. What is for sure is that all people are very tired and complain of muscle ache. And also, during the disease, a syncope or vasovagal collapse is very common with low blood pressure. Profuse sweating can also be a sign, and then of course the dry cough. Gastrointestinal symptoms are more common in children and includes diarrhea and vomiting. The disease, the first episode of the disease, the first phase, lasts for 5 to 7 days. 80% then recovers. Complains still of lots of tiredness and loss of physical abilities, but then the second phase can appear. And the second phase can rapidly evaluate towards a life-threatening disorder, namely an acute respiratory distress syndrome, where the consolidation of the complete lung fields and also then hypoxemia and death. Alarming signs that will just give that give a sign that there is a very devastating disease going on is tachypnea of the patient and stridor. Most patients don't complain of dyspnea, so they don't even feel that they are having problems with breathing, but tachypnea is present. Severe physical restriction and disabilities and exhaustion is also a very important sign and an alarming sign. And then, of course, also diminished alertness, stupor, and apathy. Most of the time, it is said that an alarming sign is people who cannot find their words anymore, who cannot speak fluently. That is not only due because they don't have the breath, they don't have the capacity of breathing, but it's most of the time a sign of this diminished alertness of mental confusion. Next slide. The risk factors of developing a severe disease, or I've put them on this slide. So there's the age, so beyond 70 years of age. Also males are more vulnerable for this disease than females. And every patient having an underlying chronic disease, as there is diabetes mellitus, chronic kidney disease, renal failure, cardiovascular disease, severe lung disease, as there is COPD and cystic fibrosis, immune deficiency already mentioned by Lut, and also severe obesity with a BMI index of more than 40. Next slide. What can we do? At this moment, the only thing that we can do, and it's all about prevention. And most of the time, what includes prevention for this disease? So, social distancing. That's important. Social distancing, as is here. Don't have crowds. Just stay within one family, and the family will include then the parents and the children. So don't shake hands. Cough in your elbow and not in your hands. Don't use cotton handkerchiefs. Don't use them. Use paper handkerchiefs and throw them away when you use them. And when sick, stay at home and call your general physician. Not go to the hospitals unless your general physician says that you have to go. A mouth mask, well, it's for sure not at this moment. For the general population, it is not clear that we have to wear them, the mouth mask, and the WHO and also our government says that it's not necessary. But if you want to have them, okay, you can carry them, of course. In the hospital, that's another story. In the hospital, all hospital staff now are carrying mouth masks. And also, there is a separation of COVID-19 patients or suspected patients from the beginning and enter the hospital. So there's certainly, everything is focused on prevention of getting the disease. Next slide. Why is prevention so important? Because you heard a lot about flattening the curve. This is the number of patients, of infected patients that we have without protective measures, and that will be done with protective measures. And in most countries, there is a lockdown, as there is also in Belgium. And I think this is also present in lots of countries like Italy, Spain, except perhaps the Netherlands, but they are going to just, to see whether they will change their habits. And Sweden is the only European country in my cognition that is still not having a lockdown. We want to prevent that our healthcare system is, well, not be able anymore to have the intensive care units possibilities to treat these patients. And at this moment, half of the intensive care units in Belgium are occupied. And therefore, we want to have the flattening of the curve. And that is also the option of all countries, certainly in Europe. Perhaps that's not the case in USA, but they will follow for sure as the number of patients increase all over the world. Yes, next slide. Well, the medication that you can use at home is paracetamol without any problem for the fever and also for those feeling sick. That you will not use, or that you don't have to use NSAID like ibuprofen is not very sure anymore. It was in the beginning of the disease that it was said that ibuprofen could not be used, but that is certainly not the case anymore. In case if you need antibiotics, your doctor can prescribe amoxicillin, but it is now also said that it must be given or prescribed at a higher dose of approximately plus 25% of the general dose. Don't use aerosols anymore, but the most important message is do not stop your current therapy or medication, continue your ERT or other medications, and certainly don't stop ACE inhibitors for Fabry patients, that's for sure. Don't stop it. Next slide. Yeah, Fabry disease is a multi-system disorder, and my colleague Dominic Germain will come back to this. So next slide. Yes. In my opinion, as you can see, that the kidneys, the cardiovascular system is affected by Fabry disease. Next slide. I'm sure then that Fabry disease is also a risk factor of having Fabry disease is a risk factor for COVID-19. And that I will show in the next slide, and as the last one.
Thank you.
So it's not only the age, the gender is male, but chronic disease. And chronic disease includes cardiac disease, chronic kidney disease, and all Fabry patients will have chronic kidney disease and or cardiac involvement. So they are at risk, in my opinion, they are certainly at risk. But Dominic Germain will come back to this in a few moments. And the last slide is then to thank you all for your attention. Thank you. I give